Hello and welcome to my short lecture on nitrous oxide, aka laughing gas. The title of it is Nitrous Oxide, a new emerging agent for hard to treat depression, ? My name is Johannes Jungwirth. I work in Zurich as a psychiatrist, and I'm not going to put you on the rack until the end of my talk, which is going to be about 10 minutes. So I created a little interactive quiz to answer the question: is nitrous oxide a new emerging agent for hard to treat depression? Yes, no, maybe, I'm scared. And I'm going to give you the answer right away. It's maybe yes. And we're definitely not scared, as I'm going to show you later in my talk. The content of it is I'm going to give you an introduction about the substance, about neurobiology. We're going to talk about phenomenology, about the psychology, about the current data, and summary and an outlook of the drug. So what is it actually? What is nitrous oxide? It's also known as laughing gas. As I told you, in German it's Stickstoffoxid. It's a colorless, odorless gas, and it's used in dental and obstetric treatments as a mild anesthetic, and it does a light sedation, it does analgesia, and it reduces anxiety, anxiolysis. Other indications are purely off-label. The dosage is between 25 and 70% mixed with pure oxygen. And that's why it's also very safe, considered very safe in medical use, but it displaces oxygen and it inactivates vitamin B12. So both can become very dangerous, and it both only happen in abuse of the substance. Little excursion to the history. The guy on the left, he was the first one who synthesized it. It's actually a naturally occurring gas. And the right guy, Humphrey David, Sir Humphrey David, he was the first one who tried it out on himself, and he gave it also the name laughing gas. And here you see a science party of in the end of the 18th century. And the guy with the wig in the middle, he inhales the gas, as you can see, and is apparently that relaxed that his pants explode. We haven't seen that in our patients yet. And it's funny, the title of the picture is called The Powers of Air. And these are other application methods. In the middle you see the kids using it with the balloons. This is a very problematic thing because teenagers really do abuse it, and it's always pure nitrous oxide, and that's dangerous. As I told you, it displaces oxygen, that causes hypoxia, and that causes severe brain damage in worst cases. On the right side you see ourselves at the clinic in our internal nitrous oxide training course. And why is it interesting for us in mental health? Giving you a hint, it's very similar to the other anesthetic, ketamine. And here we are already in the neurobiology. This is nitrous oxide. It has to be understood that nitrous oxide is a very complex molecule, even though it doesn't look like it. It has a very complex neurobiological mechanism of action that is not fully understood, but there are some general accepted mechanisms and theories that could explain its potential action or potential effect on depression. And it has been shown that the nitrous oxide modulates a vast variety of receptors and systems, and that's why we call it also a dirty drug. Here we go. Via the GABA-A receptor, it does anxiolysis. Via the opioid and alpha adrenoceptor receptors, it does analgesia, euphoria, and sedation, and so on and so on. But the main mechanism of action you see here on the right side, you see it's the NMDA receptor antagonist. So it inactivates the NMDA receptor, and we know that from ketamine, does the same, that it induces neuroplasticity, and neuroplasticity is crucial apparently for rapid acting antidepressants like ketamine. And it does so via pathways of TrkB and mTOR activation and so on and so on. But nitrous oxide also activates the TRK1 potassium channel, which is involved in long-term potentiation and therefore could also play a role in its synaptic enhancing properties. Last but not least, it also increases the level of nitric oxide inside the cell, inside the neuron, and nitric oxide has been shown to produce antidepressant, analgesic and anxiolytic effects. It is a very important gaseous neurotransmitter that plays a role in neuroprotection and so on and so on. And it's a second messenger and signaling pathways also involved in neuroplasticity. So it all enhances synaptic plasticity. And this is another study. I just want to emphasize the differences between ketamine and nitrous oxide. We showed them in our clinic. Ketamine does increase heart rate and blood pressure, widely known, and nitrous oxide actually decreases heart rate and shifts heart rate variability towards decreased sympathetic tone. In the EEG, ketamine decreases alpha activity and nitrous oxide increases alpha activity. Well, why is that interesting? Maybe this could mean that people that don't respond to ketamine could benefit from nitrous oxide. Actually, we're doing a study on that soon. What does the data say? Does it really work? And I say, yeah, it does work. There are 5 randomized controlled trials with a total of 136 patients, and all of them showed significant intervention effects. The only thing, it's debated on how long they last, okay? And I'm going to show you 3 of them. The first one I think very interesting. The first one was Nagle et al. 2015. And he showed that people with treatment-resistant depression after treatment of 1 hour showed significant improvement 2 hours after the treatment and 1 day after the treatment. But this significance vanished inside a week, okay? And the funny thing is, the same Nageles showed 6 years later the exact opposite, okay? In this phase 2 study, he showed on treatment-resistant depressed patients, severe ones actually also, that the same day and the next day there was no significant intervention effect, but 1 week and 2 weeks after the treatment, people got significantly better than in the placebo group. I think that's very interesting, and I don't know, it has probably something to do with the different pathways of inducing synaptic plasticity. And also interesting is that after 3 months, most patients showed improvement, like 85%. A lot of them showed remission, 40%. Does it have an additive and sustained cumulative efficacy, maybe? Still very small sample size. The last study is from Brazil, non-treatment resistant depression, like normal depressive patients, and they got treatment 8 times over a course of 4 weeks, 1 hour each treatment, and it showed 91% response and 75% remission. And in my opinion, that sounds a bit too good to be true. And this study also has some flaws, in my opinion, but still, it's a good direction. So what do you feel while on the drug? You feel euphoric, you have laughter, you feel time distortion, tingling sensation, lightheadedness, dissociation, sensory alteration, disinhibition, dreamlike state, and reduced pain sensation. I want to emphasize the lower ones because I hypothesize that those could contribute to psychotherapy. And here we are already in the psychology. Rapid antidepressant effects are, what does it mean? What do they mean for the people? I think it can open a window, or it can show the end of the light of the tunnel. The end of, it could show them that there's an end, there's light in the end of the tunnel, and that they see that mood improvement is possible, change is possible, and we call it a proof of concept. And this mood improvement could also encourage and motivate people for more active participation in treatment and lifestyle changes and issues. This altered state of consciousness also maybe encourage introspection and more like openness and offer new perspectives or maybe insights. And that combined with neuroplasticity can make change easier and long lasting. Little excursion to PTSD. The study in the middle showed that mothers with PTSD after a traumatic birth experience had lower severe symptoms of PTSD when they were treated with nitrous oxide instead, compared to opioid, for example. The study above was a placebo-controlled trial. Patients saw a trauma video and after that got placebo or nitrous oxide, and they showed reduced maladaptive memory consolidation and intrusive memories. And it is an NMDA receptor antagonist, as I've been showing you. And there's, of course, larger studies necessary. Very interesting are the indications and the therapeutic implications of it. Thank you very much. You saw that picture already. I'm open for questions.